Good morning, ladies and gentlemen. And first of all, may I say thank you to Julie Graylow and ASCO for giving us this opportunity to join you at this press conference. And may I also congratulate ASCO and the World Health Organization on announcing their partnership, which is critical to addressing the challenges which are so well outlined by Andre. The UICC has been around some 90 years next year, and in the last few years has become more active in bringing partnerships together to address some of the biggest issues which we face in cancer control around the world. And some time ago, about a year or so ago, we were struck by the fact that some key numbers meant that we weren't really achieving the ambition that we wanted to achieve. And that was that every individual who has a cancer diagnosis, assuming they get a cancer diagnosis in many parts of the world, has access to the medicines they need to recover from their cancer. And on that basis, we reached out to various organizations, including the World Health Organization, ASCO, Max Foundation, Global Hope, and many other organizations active in addressing the issue of cancer medicines in low and lower middle income countries, and said, what is it that we can do that can make a difference beyond that which you're trying to do at the moment? And the collective response was, how do we come together as an international community to address a highly complex problem which individual organizations, maybe working in ones and twos and threes, have done reasonably well so far, but could do so much better if they had the weight of the WHO, the weight of the industry behind it to make a difference. So we started talking to many companies and saying, we know that you want to give access to your medicines to countries which have poor health infrastructures, don't have the diagnosis capability, do not have the pathology, the trained oncologists. But what if we formed a coalition that addressed all those problems, those issues, those barriers to getting your great medicines to the people who need them day to day in countries where there are more deaths than anywhere else in the world, and where the cases will be more in the next 20 years than anywhere else in the world. And the overriding conclusion that we met with many people, many organizations, was, let's try a different model. Let's form a coalition of companies, international organizations like ASCO, the American Society for Clinical Pathology, Direct Relief, Global Hope, the Max Foundation, and many others. And let's work with companies to see if we can get their medicines into those countries, not just through donation schemes, but also at cost, tiered pricing, and if possible, through the patented medicines to the medicines patent pool based in Geneva, who could take a voluntary license on those medicines and get a generic or biosimilar manufacturer to produce them at a much lower cost for those target countries. So on May 22nd, I had the privilege of standing at the World Health Assembly to announce the formation of the ATOM Access to Oncology Medicines Coalition. And it was with great pride that I heard so many individuals say their own personal stories about why they want to get together to make a difference. I hope this will be a seismic change in the way that we address cancer around the world. I hope it'll be the way in which companies can work with organizations like ours to make a difference in countries where it's difficult to get their medicines to the right patient at the right time. And ultimately, we will save lives. Thank you.